Question 1. The investigation demonstrates that a group of registered nurses undertaking a continuing education module on advanced cardiac assessment are exhibiting varied levels of prior knowledge and confidence in their skills. The nurse educator is tasked with designing an activity to enhance their understanding and application of these complex concepts through collaborative learning. Which of the following approaches would best facilitate collaborative learning and professional development in this scenario? Option A. Design a simulation exercise where one nurse acts as the primary assessor and the others observe and provide feedback only after the exercise is completed, with the educator leading a debrief. Option B. Divide the nurses into small groups. Assign each group a specific cardiac condition to research and present to the larger group, requiring them to collaboratively develop a case study and propose a management plan, with the educator facilitating discussion and providing expert feedback. Option C. Deliver a comprehensive lecture series covering all aspects of advanced cardiac assessment, interspersed with opportunities for individual questions to the educator. Option D. Assign each nurse an individual research paper on a different aspect of advanced cardiac assessment, with the expectation that they will share their findings during a brief Q and a session at the end of the module. Correct answer is B. Divide the nurses into small groups. Assign each group a specific cardiac condition to research and present to the larger group, requiring them to collaboratively develop a case study and propose a management plan, with the educator facilitating discussion and providing expert feedback. Explanation. The investigation demonstrates a common challenge in nurse-educator roles, fostering effective collaboration among diverse learners with varying levels of experience and learning styles. The scenario is professionally challenging because the educator must not only impart knowledge, but also cultivate essential teamwork and communication skills, which are critical for safe patient care and professional growth. Careful judgment is required to select a collaborative learning technique that maximizes engagement, promotes mutual respect, and ensures all participants contribute meaningfully, aligning with the core principles of adult learning and professional development standards. The correct approach represents best professional practice because it actively involves all learners in a structured, yet flexible process designed to leverage their collective knowledge and experiences. This method encourages critical thinking, problem solving, and the development of interpersonal skills, all of which are vital for competent nursing practice. By facilitating peer-to-peer learning and shared responsibility for outcomes, it directly supports the development of a collaborative healthcare team, a key expectation in nursing education and practice. This aligns with regulatory expectations for nurse educators to prepare graduates who can function effectively in interprofessional environments. An incorrect approach that relies solely on individual assignments fails to capitalize on the benefits of collaborative learning, neglecting the development of teamwork and communication skills essential for modern healthcare. This approach may also disengage learners who thrive in interactive settings and does not prepare them for the realities of team-based patient care, potentially leading to regulatory concerns regarding the adequacy of the educational program. Another incorrect approach that assigns a single leader without clear guidance on equitable participation risks creating an environment where some learners dominate while others are marginalized. This can stifle creativity, limit diverse perspectives, and fail to develop leadership or followership skills in all participants, which is a failure to meet educational objectives and potentially a breach of ethical principles related to equitable learning opportunities. A further incorrect approach that uses a purely didactic lecture format, even if interactive questions are posed, fundamentally misses the opportunity to engage learners in active, collaborative knowledge construction. While lectures have a place, they do not foster the deep engagement and peer interaction that are hallmarks of effective collaborative learning, thus failing to meet the educational goals of developing collaborative practice. The professional decision-making process for similar situations should involve a thorough assessment of the learning objectives, the characteristics of the learner group, and the available resources. Educators should consider a range of evidence-based collaborative learning strategies, evaluating each for its potential to promote active participation, critical thinking, and the development of essential professional skills. The chosen method should be adaptable to the group's dynamics and provide clear structure and expectations to ensure equitable engagement and meaningful learning outcomes, always in alignment with professional standards and regulatory requirements for nursing education. Question 2. The audit findings indicate that the nursing curriculum's integration of evidence-based practice (EP) is not consistently reflected in learning objectives and assessment strategies across multiple courses. Which of the following approaches would best address this deficiency in accordance with U.S. nursing education regulatory frameworks and ethical standards? Option A. Develop a comprehensive plan to systematically review and revise course content, learning objectives, and assessment methods to explicitly embed EBP principles and current research findings throughout the curriculum. Option B. Advise faculty to rely more heavily on their clinical experience and established teaching methods, as these have historically prepared competent nurses. Option C. Schedule a curriculum revision meeting only when the next accreditation site visit is announced to ensure compliance. Option D. Introduce a mandatory one-day workshop for all nursing faculty on EBP, assuming this will cascade into improved curriculum content. The correct answer is A. Develop a comprehensive plan to systematically review and revise course content, learning objectives, and assessment methods to explicitly embed EBP principles and current research findings throughout the curriculum. Explanation. Scenario analysis. This scenario presents a common challenge in nursing education where curriculum content may not fully reflect current best practices. The audit findings highlight a potential gap between theoretical knowledge taught and the practical application of evidence-based practice, EP, expected in contemporary nursing. Nurse educators are ethically and professionally obligated to ensure their curriculum prepares graduates to provide safe, effective, and current patient care, which necessitates the integration of EBP. The challenge lies in identifying the most effective and efficient method to update the curriculum to meet these evolving standards. Correct approach analysis. The most effective approach involves a systematic review and revision of the curriculum to explicitly incorporate EBP principles and current research findings. This aligns with the core mission of nursing education to produce competent practitioners. Regulatory frameworks for nursing education, such as those overseen by accrediting bodies and state boards of nursing in the U.S., mandate that curricula be current and reflect the best available evidence. Ethically, failing to integrate EBP would be a disservice to students and future patients, potentially leading to suboptimal care. This approach ensures that learning objectives, teaching strategies, and assessment methods are all aligned with the goal of fostering EBP competency. Incorrect approaches analysis. One incorrect approach would be to simply add a single lecture on EBP without integrating it throughout the curriculum. This fails to demonstrate a comprehensive understanding of EBP, which is not a standalone topic, but a fundamental approach to clinical decision-making. Regulatory bodies expect EBP to be woven into the fabric of the curriculum, not treated as an isolated module. Ethically, this superficial integration does not equip students with the skills to critically appraise and apply evidence in various clinical contexts, thus failing to meet the standard of care. Another incorrect approach would be to rely solely on faculty's anecdotal experience and traditional teaching methods without actively seeking out and integrating current research. While experience is valuable, it can perpetuate outdated practices if not continually informed by evidence. U.S. nursing education standards emphasize the importance of evidence-based teaching and learning. Ethically, this approach risks teaching practices that are no longer considered best practice, potentially compromising patient safety and quality of care. A third incorrect approach would be to postpone curriculum revision until a formal accreditation review is imminent. This reactive approach is not proactive and demonstrates a lack of commitment to continuous quality improvement. Regulatory bodies expect ongoing curriculum evaluation and updates, not just periodic compliance checks. Ethically, delaying necessary updates puts students at a disadvantage and fails to uphold the profession's commitment to advancing patient care through evidence. Professional reasoning. When faced with audit findings indicating a need for curriculum improvement, a nurse educator should first acknowledge the findings and their implications. The next step is to engage in a collaborative process with faculty to identify specific areas for enhancement. This involves reviewing existing curriculum documents, comparing them against current EBP guidelines and relevant professional standards, and then developing a plan for systematic revision. This plan should include strategies for integrating EBP into learning objectives, teaching methodologies, and evaluation methods across all relevant courses. Regular review and updates should be built into the curriculum development process to ensure ongoing relevance and adherence to best practices. Question 3. Performance analysis shows that a group of nursing students are struggling to accurately apply a newly introduced medication administration protocol during their clinical rotations. The nurse educator needs to identify specific areas of difficulty and provide timely support to ensure competency before they independently manage patient care. Which type of assessment is most appropriate for this situation? Option A. A high-stakes, rated quiz administered immediately to gauge initial comprehension of the protocol. Option B. Summative assessment to evaluate overall mastery of the medication administration protocol at the end of the clinical rotation. Option C. Formative assessment designed to gather ongoing feedback on student understanding and application of the protocol. Option D. Informal observation without structured feedback to gauge general familiarity with the protocol. The correct answer is C. Formative assessment designed to gather ongoing feedback on student understanding and application of the protocol. Explanation: scenario analysis. This scenario presents a common challenge in nurse educator roles, balancing the need for immediate feedback to guide student learning with the requirement for a comprehensive evaluation of overall competency. The educator must discern the primary purpose of the assessment activity to ensure it aligns with the learning objectives and the stage of the educational process. Misinterpreting the purpose can lead to ineffective teaching strategies and inaccurate student progress evaluation. Correct approach analysis. Implementing a formative assessment strategy is the best professional practice in this situation. Formative assessment is designed to monitor student learning and provide ongoing feedback that can be used by instructors to improve their teaching and by students to improve their learning. It is diagnostic in nature, aiming to identify areas of strength and weakness, and is typically low stakes or ungraded. This approach directly supports the educator's goal of identifying specific areas where students are struggling with the new medication administration protocol, allowing for targeted remediation and reinforcement before a high-stakes evaluation. This aligns with the ethical imperative to provide effective education and support student success, as well as regulatory guidelines that emphasize competency-based education and the need for continuous improvement in nursing practice. Incorrect approaches analysis. One incorrect approach would be to treat this as a summative assessment. Summative assessment is typically conducted at the end of an instructional unit to evaluate student learning and assign a grade or measure overall achievement. Using this type of assessment to identify initial struggles with a new protocol would be premature and could unfairly penalize students who are still in the learning phase. It fails to provide the timely, actionable feedback necessary for skill development and could lead to a misrepresentation of overall competency, potentially violating professional standards of fair and accurate evaluation. Another incorrect approach would be to skip any formal assessment and rely solely on informal observation. While informal observation is valuable, it lacks the structured feedback mechanism of a formative assessment. Without a deliberate assessment designed to elicit specific responses related to the protocol, the educator might miss subtle misunderstandings or errors. This approach could lead to a failure to identify critical learning gaps, which could have implications for patient safety if students are not adequately prepared to administer medications correctly. This would be a failure to meet the professional obligation to ensure students achieve the required competencies. A third incorrect approach would be to use a high-stakes, graded assessment immediately. This would be a misapplication of summative assessment principles in a formative context. Students would likely experience significant anxiety, which can impede learning, and the focus would shift from understanding and improvement to performance under pressure. This is not conducive to learning a new, complex protocol and could lead to inaccurate conclusions about a student's true understanding and ability. It also fails to provide the supportive learning environment expected of an educator. Professional reasoning. When faced with a situation requiring evaluation of student learning, the nurse educator must first identify the purpose of the assessment. Is it to guide ongoing learning and identify areas for improvement, formative, or to measure overall achievement at the end of a learning period, summative? The educator should then select assessment methods that are appropriate for that purpose, ensuring they are aligned with the learning objectives and provide meaningful feedback to students. In this case, the need to identify and address initial difficulties with a new protocol clearly points to a formative approach. The educator should then Use the data gathered from the formative assessment to adjust teaching strategies and provide targeted support to students. Question 4. Quality control measures reveal that a student in your online nursing course has been sharing their login credentials for the Learning Management System, LMS, with another individual, who is then accessing course materials and submitting assignments. This practice has been ongoing for several weeks. As the certified nurse educator, what is the most appropriate course of action to address this situation? Option A. Immediately revoke the student's LMS access and report the incident to the Academic Integrity Committee for investigation and disciplinary action, while also reviewing and reinforcing LMS usage policies with all students. Option B. Notify the student's parents or guardians about the credential sharing and request their intervention to resolve the issue. Option C. Confront the student directly in a public forum within the LMS, detailing the specific instances of credential sharing and the potential consequences. Option D. Ignore the situation, assuming the student will eventually stop the practice, to avoid potential conflict and maintain a positive student-teacher relationship. The correct answer is A. Immediately revoke the student's LMS access and report the incident to the Academic Integrity Committee for investigation and disciplinary action, while also reviewing and reinforcing LMS usage policies with all students. Explanation. This scenario presents a professional challenge for a certified nurse educator, CNE, due to the intersection of technology use, student privacy, and academic integrity within the regulatory framework governing nursing education in the United States. The CNE must balance the benefits of technology in enhancing learning with the ethical and legal obligations to protect student data and ensure a fair assessment environment. The correct approach represents best professional practice because it prioritizes student privacy and data security, aligning with federal regulations such as the Health Insurance Portability and Accountability Act, HIPAA. If protected health information, FI, is incidentally involved, and institutional policies derived from the Family Educational Rights and Privacy Act, FERPA. It also upholds academic integrity by ensuring that technology is used to support learning and assessment without compromising fairness. Proactively addressing the issue through policy review and clear communication demonstrates a commitment to ethical teaching and compliance. An incorrect approach that involves ignoring the potential privacy breach or the misuse of student data fails to uphold the CNE's ethical duty of confidentiality and may violate FERPA, which protects the privacy of student education records. This could lead to disciplinary action, reputational damage, and legal consequences for the institution. Another incorrect approach that involves immediately terminating access without investigation or communication bypasses due process and fails to address the root cause of the issue, potentially creating further student dissatisfaction and undermining trust in the educational process. A third incorrect approach that involves sharing the specific details of the student's activity with other students violates privacy principles in FERPA, creating a hostile learning environment and potential legal ramifications. Professional decision-making in such situations requires a systematic approach. First, identify the ethical and regulatory principles at play, e.g., student privacy, academic integrity, institutional policy. Second, gather all relevant facts without making assumptions. Third, consult institutional policies and relevant legal frameworks, e.g., FERPA, institutional IT acceptable use policies. Fourth, engage in open and professional communication with the student and relevant institutional stakeholders, e.g., IT department, academic affairs. Finally, implement a solution that is fair, consistent, and upholds the highest ethical and professional standards. Question 5. The performance metrics show a consistent decline in the proficiency of experienced registered nurses in performing a specific advanced wound care technique over the past 2 quarters. As the certified nurse educator responsible for their ongoing professional development, what is the most appropriate initial risk assessment approach to address this performance gap, considering the principles of adult learning? Option A. Conduct individual performance reviews with each nurse to identify personal deficiencies and provide targeted remedial instruction based on their perceived weaknesses. Option B. Immediately develop a new, more intensive training module on the advanced wound care technique, incorporating complex theoretical concepts and research findings. Option C. Evaluate the current educational materials and delivery methods to ensure they align with andragogy, focusing on relevance, experience-based learning, and problem-solving opportunities for experienced nurses. Option D. Assume the nurses are experiencing burnout and recommend a mandatory stress management workshop to improve their overall engagement and receptiveness to learning new skills. The correct answer is C. Evaluate the current educational materials and delivery methods to ensure they align with andragogy, focusing on relevance, experience-based learning, and problem-solving opportunities for experienced nurses. Explanation. Scenario analysis. This scenario presents a common challenge for nurse educators, identifying and addressing a gap in clinical practice that stems from a lack of effective knowledge transfer. The performance metrics, indicating a decline in a specific nursing skill, suggest that the current educational approach for experienced nurses is not yielding the desired outcomes. This is professionally challenging because it requires the educator to move beyond simply delivering information and instead critically evaluate the learning process itself, considering the unique needs and experiences of adult learners. The educator must assess whether the learning principles being applied are appropriate for this experienced audience, and if the educational design fosters genuine understanding and skill application rather than rote memorization. Correct approach analysis. The correct approach involves a risk assessment focused on understanding the adult learning principles that are most effective for experienced nurses. This means recognizing that adult learners, or andragogy, are typically self-directed, bring a wealth of experience to the learning environment, are problem-centered, and are motivated by internal factors. A risk assessment in this context would evaluate how well the current educational design aligns with these principles. For instance, it would consider if the learning activities are relevant to the nurse's practice, if they allow for the integration of their existing knowledge, and if they provide opportunities for problem-solving and application. By focusing on andragogy, the educator is employing best professional practice because it directly addresses the most effective way to engage and educate adult professionals, leading to improved knowledge retention and skill performance, thereby mitigating the risk of continued suboptimal practice and potential patient harm. This aligns with the ethical imperative to provide high-quality education that supports safe and effective patient care. Incorrect approaches analysis. One incorrect approach would be to assume the nurses are simply not paying attention or are resistant to learning. This fails to acknowledge the principles of andragogy and risks alienating experienced professionals by implying a lack of motivation or capability, which is often not the root cause of learning gaps. Ethically, this approach is flawed as it places blame without a proper diagnostic assessment of the learning environment and methods. Another incorrect approach would be to immediately implement a new, complex training program without first assessing the underlying reasons for the performance decline. This is a reactive rather than a proactive strategy and may not address the core issue, potentially wasting resources and further disengaging learners if the new program also fails to align with adult learning principles. This approach carries the regulatory risk of failing to provide effective education, which could be seen as a breach of professional responsibility to maintain competency standards. A third incorrect approach would be to focus solely on the technical aspects of the skill without considering the cognitive and experiential factors of adult learning. This might involve presenting more technical data or procedures, but failing to create a learning experience that allows nurses to connect the information to their practice, solve problems, and feel a sense of ownership over their learning. This neglects the self-directed and problem-centered nature of andragogy and risks superficial learning. Professional reasoning. Professionals should approach this situation by first conducting a thorough needs assessment that considers the principles of andragogy. This involves gathering data not just on performance metrics, but also on the learning experiences of the nurses. The educator should then design or adapt educational interventions that are relevant, experiential, problem-based, and allow for learner autonomy. This iterative process of assessment, design, implementation, and evaluation, grounded in adult learning theory, ensures that educational efforts are effective, ethical, and compliant with professional standards for continuing education and competency development. Question 6. Market research demonstrates that nursing students often struggle to transition from theoretical knowledge to practical application and critical decision-making in clinical settings. As a certified nurse educator, which teaching strategy would be most effective in fostering critical thinking skills among your students, considering the need to move beyond rote memorization and promote analytical reasoning? Option A. Delivering comprehensive lectures that cover all relevant theoretical content, supplemented by assigned readings from core nursing textbooks. Option B, facilitating open-ended group discussions on clinical topics without a structured framework or specific analytical prompts. Option C, designing a course assessment strategy that primarily utilizes multiple-choice quizzes and standardized testing to evaluate knowledge acquisition. Option D, implementing a curriculum that heavily relies on case studies and incorporates reflective journaling assignments to encourage analysis of clinical scenarios and self-assessment of thought processes. The correct answer is D, implementing a curriculum that heavily relies on case studies and incorporates reflective journaling assignments to encourage analysis of clinical scenarios and self-assessment of thought processes. Explanation: scenario analysis. This scenario presents a common challenge for nurse educators, adapting teaching strategies to foster critical thinking in a diverse group of nursing students. The challenge lies in moving beyond rote memorization to equip students with the ability to analyze complex patient situations, make sound clinical judgments, and adapt to evolving healthcare landscapes. This requires educators to employ pedagogical approaches that actively engage students in higher-order thinking processes, which can be difficult to implement consistently and effectively across different learning styles and prior experiences. Correct approach analysis. The correct approach emphasizes the use of case studies and reflective journaling. This aligns with best professional practice in nursing education by promoting active learning and metacognition. Case studies, when well designed, present realistic clinical scenarios that require students to apply theoretical knowledge, analyze patient data, identify problems, and propose solutions. This process directly cultivates critical thinking skills by forcing students to move beyond recall to evaluation and synthesis. Reflective journaling complements this by encouraging students to articulate their thought processes, identify their assumptions, and evaluate the effectiveness of their decision-making. This metacognitive practice is crucial for developing self-awareness and continuous improvement in critical thinking. Regulatory frameworks for nursing education, such as those established by the Accreditation Commission for Education in Nursing, ASCEN, in the U.S., emphasize the development of critical thinking as a core competency for graduates, ensuring they are prepared for safe and effective patient care. Ethical considerations also support this approach, as nurses have an ethical obligation to provide evidence-based, patient-centered care, which necessitates strong critical thinking abilities. Incorrect approach is analysis. An approach that relies solely on lectures and textbook readings fails to adequately develop critical thinking. Lectures, while useful for content delivery, are often passive learning experiences that do not actively engage students in analysis or problem-solving. Textbooks provide foundational knowledge, but do not inherently teach students how to apply that knowledge in complex, dynamic situations. This approach risks producing nurses who can recall information, but struggle to think critically when faced with novel or ambiguous patient presentations, potentially leading to errors in judgment and compromising patient safety. This would be a failure to meet the educational standards set by accrediting bodies and could be considered an ethical lapse in preparing competent practitioners. An approach that focuses exclusively on multiple-choice quizzes and standardized testing, while useful for assessing knowledge recall, does not effectively measure or foster critical thinking. These assessment methods often test the ability to identify the single, correct answer based on memorized facts, rather than the ability to analyze a situation, weigh different options, and justify a course of action. This can lead to a curriculum that prioritizes memorization over deeper understanding and application, failing to prepare students for the nuanced decision-making required in clinical practice. This would be a failure to meet the spirit of educational standards that aim for competency beyond mere recall. An approach that prioritizes student participation in group discussions without structured guidance or clear learning objectives can be inefficient for developing critical thinking. While group discussions can be valuable, unstructured ones may devolve into sharing opinions without rigorous analysis or evidence-based reasoning. Students may not be prompted to delve deeper into the why behind their conclusions or to challenge assumptions. Without a framework for critical inquiry within the discussion, the development of critical thinking skills may be superficial. This could be seen as a missed opportunity to meet educational objectives and a less than optimal use of resources for developing essential nursing competencies. Professional reasoning. When faced with the task of teaching critical thinking, nurse educators should adopt a learner-centered approach that actively engages students in higher-order thinking processes. This involves selecting pedagogical strategies that require analysis, synthesis, and evaluation, such as case studies, problem-based learning, and simulation. Educators should also incorporate opportunities for metacognitive reflection, allowing students to examine their own thought processes and decision-making. Regular assessment of critical thinking skills, using methods that go beyond simple recall, is essential to gauge student progress and inform instructional adjustments. Collaboration with experienced clinicians and ongoing professional development in teaching methodologies will further enhance the educator's ability to foster these vital skills. Question 7. Implementation of a new baccalaureate nursing curriculum requires the selection of an overarching theoretical framework to guide its design and delivery. Which approach best reflects a systematic and evidence-based evaluation of nursing education theories for this purpose? Option A. Choosing a theory that emphasizes a single pedagogical approach, such as purely didactic instruction, to streamline curriculum development and assessment. Option B. Adopting a theory that has been successfully used in a different healthcare discipline, assuming its principles are universally applicable to nursing education. Option C. Selecting the theory most familiar to the faculty, as this ensures ease of implementation and consistent application across all courses. Option D. Prioritizing a theory that aligns with the program's specific learning outcomes, accreditation standards, and the developmental needs of nursing students, supported by a review of current educational research. The correct answer is C. Selecting the theory most familiar to the faculty, as this ensures ease of implementation and consistent application across all courses. Explanation. This scenario presents a common challenge in nursing education, selecting the most appropriate theoretical framework to guide curriculum development and student learning. The certified nurse educator must demonstrate a deep understanding of various nursing education theories and their practical application to ensure effective pedagogical strategies. The challenge lies in moving beyond superficial knowledge to a nuanced evaluation of how different theories align with specific learning objectives, student populations, and the evolving landscape of healthcare. Careful judgment is required to avoid adopting a theory that is theoretically sound but practically ineffective or misaligned with regulatory expectations for nursing education. The correct approach represents best professional practice because it demonstrates a systematic and evidence-based method for selecting a theoretical framework. It prioritizes alignment with established accreditation standards and the specific learning outcomes for the program. This approach reflects a commitment to quality education, student success, and adherence to the regulatory framework governing nursing education, which mandates that curricula be designed to prepare competent and safe practitioners. By considering the interplay between theory, practice, and regulatory requirements, the educator ensures the chosen framework will effectively support the development of critical thinking, clinical judgment, and evidence-based practice in students. An incorrect approach that focuses solely on the educator's personal preference or familiarity with a particular theory represents a significant regulatory and ethical failure. Nursing education is not about personal preference. It is about meeting established standards and preparing students for professional practice. Relying on personal preference disregards the evidence base for effective teaching and learning and fails to consider the diverse needs of students or the requirements of accrediting bodies. This can lead to a curriculum that is not rigorous, does not adequately prepare graduates for licensure exams, or fails to meet the competencies expected by regulatory agencies. Another incorrect approach, which involves adopting a theory without considering its applicability to the specific nursing program or student population, is also professionally unacceptable. This demonstrates a lack of critical analysis and a failure to engage in thoughtful curriculum design. It can result in a disconnect between theoretical underpinnings and practical application, leaving students confused or unable to translate theoretical knowledge into clinical skills. This approach fails to meet the ethical obligation to provide a high-quality educational experience that is relevant and effective for the intended learners. The professional decision-making process for similar situations should involve a multi-step approach. First, the educator must clearly define the learning objectives and desired outcomes for the nursing program. Second, they should conduct a thorough review of relevant nursing education theories, understanding their core tenets, strengths, and limitations. Third, they must critically evaluate how each theory aligns with the defined learning objectives, the characteristics of the student population, and the requirements of regulatory and accreditation bodies. This evaluation should consider the theory's potential to foster critical thinking, problem-solving, and evidence-based practice. Finally, the educator should select the theory that provides the most robust and practical framework for achieving these objectives, ensuring it can be effectively implemented and evaluated within the program. Question 8. Risk assessment procedures indicate that a group of nursing students are struggling to translate theoretical knowledge of wound care into practical application during their clinical rotations. As a certified nurse educator, which approach to facilitating their experiential learning best aligns with best practices for developing competent and reflective practitioners. Option A. Provide students with a comprehensive checklist of all wound care procedures and require them to document the completion of each step during their clinical shifts. Option B. Deliver a series of lectures and demonstrations on advanced wound care techniques, followed by a written examination to assess knowledge retention. Option C. Assign students to observe experienced nurses performing wound care for an extended period, followed by a brief cue and a session at the end of the rotation. Option D. Design clinical scenarios that require students to independently assess wounds, develop a care plan, implement interventions, and then engage in a structured debriefing session to reflect on their decision-making process and outcomes. The correct answer is D. Design clinical scenarios that require students to independently assess wounds, develop a care plan, implement interventions, and then engage in a structured debriefing session to reflect on their decision-making process and outcomes. Explanation. This scenario presents a common challenge for nurse educators, ensuring that theoretical knowledge translates into safe and effective clinical practice through meaningful experiential learning. The challenge lies in designing and evaluating learning experiences that go beyond rote memorization and foster critical thinking, skill development, and the ability to apply knowledge in complex patient care situations, all while adhering to professional standards and regulatory requirements for nursing education. The correct approach represents best professional practice because it directly aligns with the principles of experiential learning, emphasizing reflection and integration of experience into knowledge. This method encourages learners to actively process their experiences, identify learning gaps, and develop strategies for future application, which is crucial for developing competent and adaptable nurses. This aligns with the core tenets of adult learning theory and best practices in nursing education, which prioritize active engagement and self-directed learning. An incorrect approach that focuses solely on the completion of tasks without encouraging reflection fails to leverage the full potential of experiential learning. This can lead to superficial learning, where students can perform a procedure but may not understand the underlying rationale or be able to adapt their approach in novel situations. Ethically, this could be seen as a failure to adequately prepare students for the complexities of patient care, potentially impacting patient safety. Another incorrect approach that relies on passive observation without active participation or debriefing also falls short. Experiential learning requires engagement. Passive observation, while sometimes a component, is insufficient on its own to facilitate deep learning and skill acquisition. This approach neglects the critical reflective component of experiential learning and may not adequately assess the learner's understanding or ability to perform. A third incorrect approach that prioritizes instructor-led demonstration over learner autonomy and reflection misses the mark. While demonstration is a valuable teaching tool, experiential learning thrives on the learner's active involvement and their own process of discovery and application. Over-reliance on instructor-led activities can stifle independent thinking and problem-solving skills, which are essential for professional nursing practice. The professional reasoning process for similar situations involves a cyclical approach, designing learning experiences that offer opportunities for active engagement, providing structured opportunities for reflection and debriefing, assessing the learner's ability to integrate experience with knowledge, and providing constructive feedback to guide further development. This process ensures that learning is not only about acquiring knowledge, but also about developing the wisdom and judgment necessary for safe and effective nursing care. Question 9. Investigation of a nurse educator's approach to revising a core nursing course to incorporate emerging trends in patient safety and technology, What decision-making framework best aligns with the principles of evidence-based curriculum design and regulatory compliance for nursing education programs? Option A. Implementing the most cost-effective revisions by removing content deemed less critical by a small committee, without a thorough assessment of its impact on learning outcomes or accreditation requirements. Option B. Prioritizing faculty suggestions based on their years of experience in the field, assuming their collective wisdom reflects current best practices without formal external validation. Option C. Initiating a comprehensive review of current literature, accreditation standards, and best practice guidelines, followed by a collaborative process with faculty and clinical experts to identify specific content and pedagogical strategies, and then developing a pilot implementation plan with clear evaluation metrics. Option D. Adopting a curriculum model from a different nursing program that has a strong reputation, without a systematic analysis of its suitability for the specific student population and institutional resources. The correct answer is C. Initiating a comprehensive review of current literature, accreditation standards, and best practice guidelines, followed by a collaborative process with faculty and clinical experts to identify specific content and pedagogical strategies, and then developing a pilot implementation plan with clear evaluation metrics. Explanation. This scenario presents a common challenge in nurse educator roles, balancing the need for up-to-date, evidence-based curriculum with the practical constraints of resource availability and faculty buy-in. The professional challenge lies in navigating these competing demands while ensuring the curriculum meets accreditation standards and prepares graduates effectively for safe and competent practice. Careful judgment is required to select an approach that is both educationally sound and institutionally feasible. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based process for curriculum revision. This aligns with the core principles of adult learning theory and the regulatory expectations for nursing education programs, which mandate that curricula be current, relevant, and reflect the evolving landscape of healthcare. Engaging stakeholders early and using a structured decision-making framework ensures that changes are well considered, justified, and likely to be successfully implemented. This proactive and collaborative method fosters a culture of continuous quality improvement, essential for maintaining program integrity and graduate preparedness. An incorrect approach that focuses solely on faculty preference without considering external evidence or accreditation standards fails to uphold the professional responsibility to deliver a curriculum grounded in best practices. This could lead to a curriculum that is outdated, does not meet regulatory requirements, and ultimately fails to prepare graduates adequately for the complexities of modern nursing. Such an approach risks non-compliance with accreditation bodies and ethical breaches related to professional competence. Another incorrect approach that prioritizes immediate cost savings over curriculum quality is also professionally unacceptable. While fiscal responsibility is important, it should not compromise the educational mission or the safety of future patients. A curriculum that is under-resourced or lacks essential components due to budget cuts can lead to graduates who are not fully prepared, posing a risk to patient care and the nursing profession. This approach demonstrates a failure to prioritize the core mandate of nursing education. A third incorrect approach that relies on anecdotal evidence or personal experience without systematic evaluation is problematic. While faculty experience is valuable, curriculum decisions must be based on robust evidence, including research, expert consensus, and accreditation guidelines. Relying on informal opinions can lead to the perpetuation of outdated practices or the inclusion of unproven methodologies, undermining the scientific basis of nursing education. The professional decision-making process for similar situations should involve a structured approach. 1. Identify the need for curriculum change, supported by data e.g., student outcomes, faculty feedback, changes in practice, accreditation requirements. 2. Formulate clear learning objectives for the proposed curriculum changes. 3. Conduct a thorough literature review and consult relevant professional guidelines and accreditation standards. 4. Engage key stakeholders, faculty, students, clinical partners, administrators, to gather input and build consensus. 5. Develop a systematic plan for curriculum revision, including resource assessment and implementation strategies. 6. Evaluate the effectiveness of the implemented changes and make further adjustments as needed, fostering a cycle of continuous improvement. Question 10. The audit findings indicate a need to strengthen the process for evaluating the clinical competence of newly graduated registered nurses during their initial orientation period. Which of the following approaches best aligns with regulatory requirements and professional standards for assessing clinical competence? Option A. Rely primarily on the nurse's performance on a national certification examination taken prior to employment as the sole indicator of clinical competence. Option B. Conduct a single, informal performance review at the end of the nurse's first year of employment to assess overall clinical competence. Option C. Implement a comprehensive evaluation plan that includes direct observation of patient care, simulation exercises, review of patient records, and feedback from preceptors and supervisors, with documented assessments at regular intervals throughout the orientation period. Option D. Utilize anecdotal feedback from colleagues and casual observations by the nurse educator as the primary method for determining clinical competence. Correct answer is C. Implement a comprehensive evaluation plan that includes direct observation of patient care, simulation exercises, review of patient records, and feedback from preceptors and supervisors, with documented assessments at regular intervals throughout the orientation period. Explanation. The audit findings indicate a potential gap in the evaluation of clinical competence for newly graduated nurses. This scenario is professionally challenging because ensuring a new nurse's competence is paramount to patient safety and aligns with the core responsibilities of a nurse educator. The challenge lies in balancing the need for thorough evaluation with the integration of new staff into the clinical environment, requiring careful judgment to avoid both under-evaluation, risking patient harm, and overvaluation, creating unnecessary barriers to practice. The correct approach represents best professional practice because it directly addresses the audit findings by implementing a structured, multifaceted evaluation process that aligns with established nursing standards and regulatory expectations for competency assessment. This approach prioritizes objective data collection, incorporates feedback from multiple sources, and ensures that the evaluation is directly linked to the essential functions of the registered nurse role, as defined by the relevant nursing practice acts and accreditation standards. This systematic method provides a defensible and transparent process for determining a nurse's readiness to practice independently, thereby upholding the profession's commitment to patient safety and quality care. An incorrect approach that relies solely on informal observation or anecdotal evidence fails to meet regulatory requirements for objective and documented competency assessment. This approach is ethically problematic as it risks overlooking critical deficits in a nurse's skills or judgment, potentially jeopardizing patient well-being. Furthermore, it lacks the rigor necessary to satisfy professional standards and could lead to disciplinary action if a patient is harmed due to an inadequately assessed nurse. Another incorrect approach that focuses exclusively on the nurse's ability to pass a standardized test, while important, is insufficient on its own. Clinical competence encompasses more than theoretical knowledge. It involves the application of that knowledge in complex, real-world patient care situations. Relying solely on a test score neglects the practical, hands-on aspects of nursing care and the ability to make sound clinical judgments under pressure, which are critical components of competence as outlined in professional nursing standards. A third incorrect approach that involves delaying formal competency evaluation until a significant period after hire is also professionally unacceptable. Regulatory frameworks and best practices emphasize timely assessment to identify and address any learning needs or performance issues early in a nurse's career. Postponing evaluation increases the risk of prolonged exposure of patients to potential errors and undermines the educator's role in guiding and supporting the nurse's development. The professional decision-making process for similar situations should involve a thorough understanding of the relevant nursing practice acts, accreditation standards, and institutional policies regarding competency assessment. Educators must prioritize patient safety by employing objective, evidence-based evaluation methods that are comprehensive and timely. This includes utilizing a variety of assessment tools, such as direct observation, simulation, chart reviews, and peer and supervisor feedback, to gain a holistic view of the nurse's capabilities. Regular review and updating of evaluation processes based on audit findings and evolving best practices are also crucial to maintaining high standards of clinical competence within the nursing workforce. Question 11. The assessment process reveals that a nursing student has completed a case study involving a complex patient scenario. During the debriefing, the student presents a plan of care that addresses some, but not all, of the patient's critical needs. The nurse educator needs to evaluate the student's understanding and clinical reasoning. Which approach best facilitates this evaluation and promotes the student's development as a competent nurse? Option A. Provide the student with the instructor's ideal plan of care and ask the student to identify the differences and explain why their plan was not optimal. Option B. Grade the student's written case study response based on a rubric and provide a score without further discussion or probing questions. Option C. Focus on the final plan of care and highlight the areas where it deviates from the expected outcomes, without delving into the student's thought process. Option D. Ask the student to explain the rationale behind each component of their proposed plan of care. Explore alternative interventions they considered and why they were not chosen, and discuss potential consequences of their chosen actions. Correct answer is D. Ask the student to explain the rationale behind each component of their proposed plan of care, explore alternative interventions they considered and why they were not chosen, and discuss potential consequences of their chosen actions. Explanation. Scenario analysis. This scenario presents a common challenge in nurse educator roles, evaluating student performance in a complex real-world context using case-based learning. The challenge lies in moving beyond simple recall of facts to assessing critical thinking, clinical reasoning, and application of knowledge in a simulated patient situation. The educator must discern whether the student's approach reflects a superficial understanding or a genuine grasp of the underlying principles and their practical implications, all within the ethical and regulatory boundaries of nursing practice. Correct approach analysis. The most effective approach involves a structured debriefing that probes the student's decision-making process. This aligns with the regulatory framework for nursing education, which emphasizes the development of competent practitioners capable of safe and effective patient care. By asking why questions and exploring alternative actions, the educator can assess the student's ability to analyze the case, identify key issues, prioritize interventions, and justify their choices. This method directly evaluates the cognitive skills essential for nursing practice and is supported by professional nursing standards that advocate for evidence-based practice and critical thinking. It allows for a nuanced understanding of the student's learning and identifies areas for targeted remediation, ensuring the student meets the required competencies before independent practice. Incorrect approach is analysis. One incorrect approach is to focus solely on the student's final proposed plan of care without exploring the reasoning behind it. This fails to assess the critical thinking process, potentially overlooking fundamental misunderstandings or gaps in knowledge. It is a superficial evaluation that does not meet the educational objectives of case-based learning, which are designed to foster analytical skills, not just the ability to arrive at a correct answer. This approach could lead to a student being deemed competent when they are not, posing a risk to future patient safety and violating the educator's ethical responsibility to ensure adequate preparation. Another incorrect approach is to provide the student with the correct answers and then ask them to identify where they deviated. While this might highlight discrepancies, it shifts the focus from the student's independent reasoning to a passive comparison. It does not allow the educator to understand the student's thought process or the rationale for their initial decisions. This method is less effective in identifying the root cause of any errors and does not promote deep learning or the development of independent problem-solving skills, which are crucial for professional nursing practice and are implicitly required by nursing licensure and practice standards. A third incorrect approach is to simply grade the student's written case study response without any interactive discussion or feedback. Case-based learning is inherently interactive and designed to facilitate dialogue and deeper understanding. A purely summative, non-interactive evaluation misses the opportunity for formative feedback and collaborative learning. It fails to address the dynamic nature of clinical decision-making and the importance of communication and justification in nursing practice, as expected by regulatory bodies overseeing nursing education and licensure. Professional reasoning. Professionals should employ a decision-making framework that prioritizes understanding the student's cognitive processes. This involves active listening, open-ended questioning, and a focus on the why behind the student's actions and decisions. The educator should aim to create a safe learning environment where students feel comfortable articulating their reasoning, even if it contains errors. The goal is to identify learning needs and guide the student toward developing robust critical thinking and clinical judgment skills, ensuring they meet the standards of professional nursing practice as defined by regulatory bodies and ethical codes. Question 12. System analysis indicates that a certified nurse educator is designing a module on medication administration safety for baccalaureate nursing students. The educator wants to incorporate active learning strategies to enhance student understanding and retention of critical safety protocols. Which of the following approaches best optimizes the process for achieving the intended learning outcomes? Option A. Implementing a group discussion where students share their personal experiences with medication administration, regardless of whether those experiences directly relate to the specific safety protocols being taught. Option B. Assigning students to independently research and present on various aspects of medication safety, with the educator providing minimal feedback on the accuracy or completeness of their findings. Option C. Utilizing a gamified quiz with immediate feedback on correct answers, but without any opportunity for students to explore the underlying principles or consequences of incorrect choices. Option D. Selecting a simulation-based scenario where students must identify and correct medication errors, followed by a debriefing session focused on the critical thinking processes used and the rationale behind each correction, with pre- and post-module knowledge assessments. The correct answer is D. Selecting a simulation-based scenario where students must identify and correct medication errors, followed by a debriefing session focused on the critical thinking processes used and the rationale behind each correction, with pre- and post-module knowledge assessments. Explanation. Scenario analysis. This scenario presents a common challenge for nurse educators, ensuring that active learning strategies are not only implemented, but also demonstrably effective in achieving specific learning outcomes. The challenge lies in moving beyond superficial engagement to deep, meaningful learning that translates into improved nursing practice. Educators must balance the need for engaging activities with the imperative to meet curriculum objectives and prepare students for competent practice, all within the scope of professional nursing education standards. Correct approach analysis. The correct approach focuses on aligning active learning strategies with measurable learning outcomes and evaluating their impact on student comprehension and retention. This aligns with the core principles of effective nursing education, which emphasize evidence-based teaching and continuous quality improvement. By selecting strategies that directly address the stated learning objectives and then assessing their effectiveness through appropriate evaluation methods, the educator ensures that the learning experience is purposeful and contributes to the development of competent nurses. This approach is ethically sound as it prioritizes student learning and professional development, and it is professionally responsible by adhering to best practices in educational methodology. Incorrect approaches analysis. One incorrect approach might involve prioritizing student preference for a particular activity over its pedagogical effectiveness in achieving learning outcomes. This fails to meet professional standards by potentially sacrificing deep learning for superficial engagement. Ethically, it is a disservice to students if their education is not optimized for competence. Another incorrect approach could be the sole reliance on passive observation of student participation without assessing actual learning. This neglects the educator's responsibility to ensure knowledge acquisition and skill development, a fundamental ethical and professional obligation in nursing education. It also fails to provide data for process optimization. A third incorrect approach might be the implementation of a novel active learning strategy without a clear rationale tied to specific learning objectives or without a plan for evaluation. This demonstrates a lack of systematic instructional design and can lead to wasted resources and ineffective learning, which is professionally unsound and ethically questionable as it does not guarantee quality education. Professional reasoning. When selecting and implementing active learning strategies, nurse educators should employ a systematic process. This involves 1. Clearly defining the learning outcomes for the session. 2. Selecting active learning strategies that are known to promote the achievement of those specific outcomes. 3. Planning for the assessment of student learning during and after the activity to gauge effectiveness. 4. Reflecting on the results to refine future teaching practices. This iterative process ensures that teaching is responsive to student needs and aligned with professional standards for nursing education. Question 13. The analysis reveals that a certified nurse educator is tasked with selecting a theoretical framework to guide the development of a new undergraduate nursing curriculum. The program aims to foster critical thinking, evidence-based practice, and compassionate care. The CNE has identified several potential frameworks, each with different strengths and emphases. The educator must choose the framework that best supports these program goals, while also ensuring compliance with the relevant nursing education accreditation standards. Which of the following approaches to selecting a theoretical framework represents the most sound professional judgment? Option A. Implementing a framework that is highly complex and theoretical, requiring extensive faculty development, with the expectation that its depth will inherently lead to superior student learning. Option B. Selecting a framework that has been recently published and is popular in other disciplines, assuming its innovative nature will translate to improved nursing education outcomes. Option C. Choosing a framework that is familiar to the majority of the faculty, even if it has limited empirical evidence of effectiveness in nursing education and does not explicitly address all program goals. Option D. Adopting a framework that is well established in nursing education, has demonstrated effectiveness in promoting critical thinking and evidence-based practice, and can be clearly linked to the program's stated learning outcomes and accreditation requirements. The correct answer is B. Selecting a framework that has been recently published and is popular in other disciplines, assuming its innovative nature will translate to improved nursing education outcomes. Explanation. Scenario analysis. This scenario is professionally challenging because the certified nurse educator, CNE, must select a theoretical framework that not only aligns with the program's goals, but also meets the stringent requirements of the accrediting body and promotes effective learning outcomes for diverse student populations. The CNE must balance pedagogical soundness with regulatory compliance and ethical considerations regarding student success and professional readiness. The pressure to demonstrate program effectiveness and student competency to external stakeholders adds another layer of complexity. Correct approach analysis. The correct approach involves selecting a theoretical framework that is well established in nursing education, demonstrably supports the development of critical thinking and clinical reasoning, and can be empirically evaluated for its effectiveness in achieving stated curriculum objectives. This aligns with the core principles of evidence-based practice in education, emphasizing the use of frameworks that have a strong theoretical basis and a track record of positive outcomes. Furthermore, it ensures compliance with accreditation standards that mandate a systematic and outcome-oriented approach to curriculum design and evaluation. The chosen framework should also be adaptable to different learning styles and promote inclusivity, reflecting ethical obligations to all students. Incorrect approach is analysis. An approach that prioritizes a framework solely based on its novelty or the personal preference of the faculty without rigorous evaluation of its pedagogical merit or alignment with accreditation standards is professionally unacceptable. This could lead to a curriculum that is not evidence-based, potentially hindering student learning and failing to meet regulatory requirements. Another incorrect approach would be to adopt a framework that is overly prescriptive and rigid, leaving little room for faculty innovation or adaptation to evolving healthcare needs and student feedback. This can stifle creativity and fail to address the dynamic nature of nursing practice, potentially leading to graduates who are not adequately prepared for the complexities of the profession. Such an approach may also inadvertently create barriers for students with diverse learning needs, raising ethical concerns about equity and access. Finally, selecting a framework that lacks clear, measurable outcomes or is difficult to evaluate would be a failure. This would make it challenging to demonstrate program effectiveness to accrediting bodies and to identify areas for improvement, thus not upholding the professional responsibility to ensure quality education. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the program's mission, goals, and learning outcomes. This should be followed by a comprehensive review of relevant theoretical frameworks, considering their alignment with nursing education principles, empirical support, and adaptability. Consultation with faculty, consideration of student needs, and a review of accreditation standards are crucial steps. The final decision should be based on a framework that is theoretically sound, practically applicable, and demonstrably effective in fostering student learning and professional competence, while also being amenable to ongoing evaluation and improvement. Question 14. The risk matrix shows a moderate risk associated with the potential for graduates of a nurse educator certification preparation program to lack demonstrable skills in curriculum development and evaluation. As the program's lead educator, which approach to defining learning outcomes for the curriculum development module best mitigates this risk and aligns with professional standards for nurse educators. Option A. Establish learning outcomes that primarily aim to achieve high student satisfaction ratings for the curriculum development module, as indicated by post-course evaluations. Option B. Focus learning outcomes on the student's capacity to articulate theoretical frameworks of curriculum design and engage in in-depth discussions about historical approaches to nursing education. Option C. Define learning outcomes based on the instructor's perceived expertise in curriculum development, emphasizing the breadth of topics that can be covered within the module. Option D. Develop learning outcomes that focus on the student's ability to design a comprehensive curriculum plan, including rationale for content selection, appropriate pedagogical strategies, and methods for evaluating student learning and program effectiveness. The correct answer is D. Develop learning outcomes that focus on the student's ability to design a comprehensive curriculum plan, including rationale for content selection, appropriate pedagogical strategies, and methods for evaluating student learning and program effectiveness. Explanation. Scenario analysis. This scenario presents a common challenge for nurse educators, aligning learning outcomes with the practical realities of clinical practice and the expectations of regulatory bodies. The difficulty lies in ensuring that the stated learning outcomes are not only achievable within the educational setting, but also directly contribute to the development of competencies required for safe and effective nursing practice as defined by the Certified Nurse Educator, CNE, credentialing body, and relevant state nursing practice acts. The educator must balance theoretical knowledge with practical application and demonstrate how the learning process prepares students for professional accountability. Correct approach analysis. The correct approach prioritizes the development of measurable and observable learning outcomes that directly reflect the competencies expected of a certified nurse educator. This aligns with the core principles of adult learning theory and best practices in curriculum design, emphasizing what the learner will be able to do upon completion of the educational activity. Such outcomes are essential for effective assessment, program evaluation, and ultimately, for ensuring that graduates meet the standards set by the CNE credentialing body and are prepared for professional practice. This approach demonstrates a commitment to evidence-based education and professional accountability. Incorrect approaches analysis. One incorrect approach focuses solely on the breadth of content covered, neglecting the critical aspect of whether students can actually apply that knowledge in a meaningful way. This fails to establish clear, measurable learning objectives and can lead to superficial learning, where students can recall information but cannot demonstrate competence. This is a failure to meet the standards of effective pedagogy and professional development expected of a CNE. Another incorrect approach emphasizes the instructor's expertise and the depth of theoretical discussion without clearly linking it to observable student performance. While instructor knowledge is vital, learning outcomes must be learner-centered and demonstrable. This approach risks creating a passive learning environment and does not provide a clear framework for assessing student achievement against established professional standards. It neglects the requirement for measurable outcomes that are fundamental to educational accreditation and professional credentialing. A third incorrect approach prioritizes student satisfaction surveys as the primary measure of educational success. While student feedback is valuable for program improvement, it is not a direct measure of learning outcome achievement or the development of essential professional competencies. Relying solely on satisfaction can lead to a curriculum that is perceived as easy or enjoyable, but may not adequately prepare students for the rigorous demands of certified nurse education. This approach fails to uphold the professional responsibility to ensure robust learning and competency development. Professional reasoning. Nurse educators must employ a systematic decision-making process that begins with understanding the overarching goals of the educational program and the specific competencies required by the relevant professional bodies, e.g., CNE credentialing standards, state nursing practice acts. This involves defining clear, measurable, achievable, relevant, and time-bound, SMART learning outcomes. These outcomes then guide the selection of content, teaching strategies, and assessment methods. Regular evaluation of the curriculum against these outcomes and professional standards is crucial for continuous improvement and ensuring the program's effectiveness in preparing competent professionals. Question 15. Research into the most effective methods for integrating interprofessional education into a certified nurse educator program, with the goal of enhancing graduates' preparedness for collaborative healthcare practice, has yielded several proposed approaches. Which approach best aligns with the regulatory framework and ethical imperatives for nursing education in preparing competent, collaborative healthcare professionals? Option A. Introduce ad hoc, informal opportunities for students to interact with other healthcare professionals during clinical rotations, without a structured curriculum or defined learning objectives for interprofessional engagement. Option B. Emphasize the theoretical underpinnings of interprofessional collaboration through lectures and readings, assuming that knowledge acquisition alone will enable graduates to function effectively in interprofessional teams. Option C. Design and implement curriculum modules that explicitly focus on developing interprofessional competencies such as communication, teamwork, and conflict resolution, utilizing simulated or actual clinical scenarios where nursing students interact with students from other health professions. Option D. Continue to prioritize discipline-specific learning experiences, with minimal or optional opportunities for students to engage with other healthcare disciplines, believing that core nursing knowledge is paramount. The correct answer is C. Design and implement curriculum modules that explicitly focus on developing interprofessional competencies such as communication, teamwork, and conflict resolution, utilizing simulated or actual clinical scenarios where nursing students interact with students from other health professions. Explanation. This scenario presents a common challenge in nursing education, effectively integrating interprofessional education, IPE, into the curriculum to prepare graduates for collaborative healthcare environments. The professional challenge lies in designing and implementing IPE experiences that are not only educationally sound, but also align with the regulatory expectations for nursing education programs, ensuring graduates possess the necessary competencies for safe and effective interprofessional practice. Careful judgment is required to balance the theoretical underpinnings of IPE with practical implementation constraints and to demonstrate measurable outcomes that satisfy accreditation standards. The correct approach represents best professional practice because it directly addresses the core objectives of IPE as mandated by nursing regulatory bodies and accreditation standards. By focusing on developing specific interprofessional competencies, such as communication, teamwork, and conflict resolution, and by incorporating authentic clinical scenarios, the educator ensures that students are exposed to real-world collaborative practice. This aligns with the regulatory expectation that nursing programs prepare graduates to function effectively within interprofessional teams, thereby enhancing patient safety and care quality. Such an approach is grounded in evidence-based educational strategies and demonstrates a commitment to meeting program outcomes required for accreditation. An incorrect approach that focuses solely on theoretical knowledge of IPE without practical application fails to meet regulatory requirements for competency-based education. Nursing programs are expected to produce graduates who can do not just no. Without hands-on experience in simulated or actual interprofessional settings, students cannot develop the practical skills necessary for effective collaboration, which is a critical component of safe patient care and a key expectation of regulatory bodies. Another incorrect approach that prioritizes discipline-specific learning over collaborative activities neglects the fundamental purpose of IPE. Regulatory frameworks emphasize the importance of preparing nurses to work with other healthcare professionals. Isolating nursing students in their learning, even if the content is robust, does not equip them for the interprofessional nature of modern healthcare delivery. This failure to integrate interprofessional learning directly contravenes the spirit and letter of regulations promoting collaborative practice. A third incorrect approach that relies on ad hoc, uncoordinated IPE activities lacks the systematic design and evaluation necessary for effective educational programming. Regulatory bodies expect structured curricula with clear learning objectives and measurable outcomes. Unplanned or superficial IPE experiences are unlikely to foster the deep understanding and skill development required, and they fail to demonstrate a commitment to a robust IPE framework, potentially leading to non-compliance with accreditation standards. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify regulatory and accreditation expectations for IPE within the specific jurisdiction. 2. Define clear, measurable interprofessional learning outcomes for the nursing program. 3. Design IPE experiences that are authentic, integrated into the curriculum, and provide opportunities for active participation and reflection. 4. Collaborate with faculty from other disciplines to ensure alignment and shared responsibility for IPE. 5. Develop methods for evaluating student achievement of interprofessional competencies. 6. Continuously assess and refine IPE strategies based on student feedback, faculty input, and outcome data to ensure ongoing compliance and educational effectiveness. Question 16. Examination of the data shows that a certified nurse educator is preparing to deliver a lecture on advanced cardiac assessment to a group of experienced registered nurses pursuing a master's degree. The educator wants to maximize learner engagement and knowledge retention. Which lecture technique approach would best align with current best practices in adult education and regulatory expectations for nursing education? Option A. Integrate interactive elements such as polling questions, brief case study analyses, and opportunities for peer discussion throughout the lecture, interspersed with concise didactic content. Option B. Rely primarily on a single, complex simulation scenario that requires extensive prior knowledge without foundational review or interactive checkpoints. Option C. Focus exclusively on presenting extensive statistical data and research findings without incorporating opportunities for application or clarification during the session. Option D. Deliver a comprehensive, uninterrupted lecture using detailed PowerPoint slides, assuming the advanced learners will independently process the information. The correct answer is A. Integrate interactive elements such as polling questions, brief case study analyses, and opportunities for peer discussion throughout the lecture, interspersed with concise didactic content. Explanation. Scenario analysis. This scenario presents a common challenge for nurse educators, adapting lecture techniques to meet diverse learning needs within a single educational session. The professional challenge lies in balancing the need for efficient knowledge dissemination with the imperative to ensure comprehension and engagement for all learners, adhering to established pedagogical best practices and regulatory expectations for quality nursing education. Careful judgment is required to select and implement lecture strategies that are both effective and compliant with the standards governing nurse educator practice. Correct approach analysis. The correct approach emphasizes active learning strategies integrated into the lecture format. This aligns with best practices in adult education and nursing pedagogy, which advocate for learner-centered approaches that promote critical thinking and knowledge retention. By incorporating techniques like think, pair, share, case study discussions, and polling, the educator actively involves learners, caters to different learning styles, and provides immediate feedback opportunities. This approach is ethically sound as it prioritizes the learner's success and is consistent with regulatory guidelines that mandate effective teaching methodologies to prepare competent nurses. Incorrect approaches analysis. One incorrect approach focuses solely on delivering information through passive methods like lengthy monologues and extensive PowerPoint slides, without interactive elements. This fails to meet the regulatory expectation for engaging and effective instruction, potentially leading to poor knowledge acquisition and retention. Ethically, it neglects the educator's responsibility to facilitate learning for all students, particularly those who may struggle with passive information delivery. Another incorrect approach involves relying heavily on a single, untested lecture technique without considering the audience's prior knowledge or learning preferences. This can be inefficient and may alienate a significant portion of the learners, hindering their ability to grasp the material. Regulatory frameworks often implicitly or explicitly require educators to employ varied and appropriate teaching methods, and a one-size-fits-all approach can be seen as a failure to meet these standards. A third incorrect approach might involve neglecting to assess learner understanding during the lecture, opting instead for a summative evaluation at the end. This misses crucial opportunities for formative feedback and remediation, which are essential for effective teaching and learning. It can lead to students leaving the session with misconceptions that are difficult to correct later, potentially impacting their future practice and failing to meet the standards of comprehensive nursing education. Professional reasoning. Nurse educators should employ a decision-making process that begins with understanding the learning objectives and the characteristics of the learner population. They should then research and select lecture techniques supported by evidence-based pedagogy, considering how these techniques can be integrated to promote active engagement and cater to diverse learning styles. Regular formative assessment throughout the lecture is crucial to gauge understanding and adjust teaching strategies as needed. Finally, educators must reflect on the effectiveness of their chosen techniques and seek opportunities for professional development to continuously improve their lecture delivery skills, ensuring compliance with regulatory standards for quality nursing education. Question 17. System analysis indicates that a nurse educator is proposing the adoption of a novel, technology-driven pedagogical approach for a core undergraduate nursing course. While the educator believes this method will significantly enhance student engagement and critical thinking, there is uncertainty about its alignment with the current accreditation standards of the Commission on Collegiate Nursing Education, CCNE. The educator is considering proceeding with implementation due to the perceived educational benefits. Which of the following actions best reflects adherence to accreditation standards and professional responsibility? Option A. Prioritize the educator's professional judgment regarding the innovative approach over potential, unconfirmed accreditation concerns, and implement the changes without further consultation. Option B. Conduct a thorough review of the proposed pedagogical approach against the relevant CCNE accreditation standards, seeking clarification from program leadership and potentially the CCNE if ambiguities exist, before implementation. Option C. Implement the new teaching methods immediately to capitalize on their perceived benefits, assuming that innovative approaches are inherently compliant with accreditation standards. Option D. Proceed with the new teaching methods and address any potential accreditation issues that may arise during the next accreditation cycle. The correct answer is B. Conduct a thorough review of the proposed pedagogical approach against the relevant CCNE accreditation standards, seeking clarification from program leadership and potentially the CCNE if ambiguities exist, before implementation. Explanation. Scenario analysis. This scenario presents a common challenge for nurse educators, balancing the need for innovative curriculum development with the stringent requirements of accreditation standards. The challenge lies in ensuring that new pedagogical approaches, while potentially beneficial, do not inadvertently lead to non-compliance with established accreditation criteria, which are designed to ensure quality and safety in nursing education. The educator must critically evaluate the proposed changes against the specific standards of the accrediting body, in this case, the Commission on Collegiate Nursing Education, CCNE, in the United States. Correct approach analysis. The correct approach involves a thorough review of the proposed curriculum changes against the CCNE accreditation standards. This demonstrates a commitment to quality assurance and regulatory compliance, which are paramount in nursing education. By proactively identifying potential areas of non-compliance and seeking guidance from the accreditation body or experienced colleagues, the educator ensures that the program remains aligned with established benchmarks for student learning outcomes, faculty qualifications, and program effectiveness. This aligns with CCNE Standard Roman II, Curriculum and Program Evaluation, which emphasizes the need for a curriculum that prepares graduates for professional practice and is regularly evaluated for effectiveness. Incorrect approaches analysis. One incorrect approach involves implementing the new teaching methods without a formal review against CCNE standards. This poses a significant risk of noncompliance, potentially jeopardizing the program's accreditation status. Such an action disregards the foundational principle of accreditation, which is to uphold specific quality standards. This failure directly contravenes CCNE Standard Roman II, which requires that the curriculum be designed to meet program outcomes and that the program be evaluated for its effectiveness in achieving these outcomes. Another incorrect approach is to assume that innovative teaching methods automatically meet accreditation requirements. Innovation is valuable, but it must be demonstrably effective and aligned with the competencies expected of nursing graduates as defined by accreditation bodies. Without explicit alignment and evidence of effectiveness, this assumption can lead to a curriculum that, while novel, may not adequately prepare students for licensure and practice, a core tenet of CCNE standards. This overlooks the evaluative component of CCNE Standard Roman II, which necessitates demonstrating the program's success in preparing competent practitioners. A third incorrect approach is to prioritize the perceived benefits of the new methods over potential accreditation concerns without seeking clarification. While educator autonomy is important, it must be exercised within the bounds of regulatory compliance. Ignoring potential issues or failing to engage with the accreditation body for guidance represents a failure in professional responsibility and due diligence. This approach neglects the collaborative and transparent nature of the accreditation process, which encourages dialogue and proactive problem-solving to ensure program quality. Professional reasoning. When faced with curriculum changes that may impact accreditation, nurse educators should adopt a systematic, evidence-based, and compliance-oriented decision-making process. This involves 1. Understanding the specific accreditation standards relevant to the proposed changes. 2. Conducting a gap analysis to identify any potential discrepancies between the proposed changes and the standards. 3. Consulting with program leadership, faculty colleagues, and potentially the accreditation body for clarification and guidance. 4. Documenting the rationale for the changes and the steps taken to ensure compliance. 5. Implementing changes in a phased manner, if possible, with ongoing evaluation to monitor effectiveness and compliance. This structured approach ensures that innovation is pursued responsibly and ethically, safeguarding both the program's accreditation and the quality of nursing education. Question 18. To address the challenge of a recent cohort of nursing students achieving a significantly lower pass rate on a national standardized predictor exam than previous cohorts, a nurse educator is considering various approaches to improve future student performance. Which of the following approaches best aligns with professional best practices and regulatory expectations for nursing education? Option A. Focus solely on the overall pass rate of the standardized test and implement remedial tutoring for students who score below the program's established benchmark, without further investigation into the test's validity or curriculum alignment. Option B. Conduct a thorough review of the standardized test's psychometric properties, its alignment with the program's curriculum and learning outcomes, and national practice standards to identify potential areas for curriculum or pedagogical enhancement. Option C. Immediately revise the curriculum to incorporate more content directly from the standardized test's review materials, assuming the current curriculum is insufficient. Option D. Lower the passing threshold for the standardized predictor exam within the program to increase the observed pass rate for the next cohort. The correct answer is B. Conduct a thorough review of the standardized test's psychometric properties, its alignment with the program's curriculum and learning outcomes, and national practice standards to identify potential areas for curriculum or pedagogical enhancement. Explanation. Scenario analysis. This scenario presents a common challenge in nursing education, ensuring the validity and reliability of standardized testing while also promoting student success and program integrity. Nurse educators are tasked with using assessments that accurately reflect student competency and preparedness for professional practice, adhering to established accreditation standards and legal requirements for nursing education. The challenge lies in balancing the need for rigorous evaluation with the ethical obligation to support student learning and development. Misinterpreting or misapplying standardized test results can lead to unfair student outcomes, compromise program accreditation, and ultimately impact the quality of nursing care provided by graduates. Correct approach analysis. The correct approach involves a comprehensive review of the standardized test's psychometric properties, including its validity, does it measure what it intends to measure, and reliability, are the results consistent. This aligns with the principles of sound educational assessment and is implicitly supported by accreditation standards, e.g., Accreditation Commission for Education in Nursing (ASCEN), or Commission on Collegiate Nursing Education, CCNE in the U.S., which require programs to demonstrate the effectiveness of their curriculum and assessment strategies. Furthermore, it reflects ethical practice by ensuring that student evaluation is based on objective, evidence-based measures, analyzing the test's alignment with program learning outcomes and national practice standards, e.g., NCLEX test plan, is crucial for demonstrating its relevance and utility in preparing graduates for licensure. This approach prioritizes data-driven decision-making and upholds the integrity of the nursing education program. Incorrect approach is analysis, an approach that focuses solely on the pass rate of the standardized test without considering its psychometric properties or alignment with curriculum is professionally unacceptable. This fails to address whether the test is a true measure of competency or if it might be flawed, leading to potentially inaccurate conclusions about student preparedness or curriculum effectiveness. It also risks overlooking systemic issues within the curriculum or teaching methods that might be contributing to lower scores, instead attributing all variance to student ability. Another incorrect approach would be to immediately revise the curriculum based on a single low pass rate without investigating the root cause. This is premature and potentially detrimental, as it assumes the curriculum is the sole issue without considering other factors like test validity, student preparedness, or external influences. It bypasses the critical step of diagnostic analysis and could lead to unnecessary and ineffective curriculum changes. Finally, an approach that involves lowering the passing score on the standardized test to improve student outcomes is ethically and professionally unsound. This undermines the purpose of standardized testing as a measure of entry-level competency and can compromise the quality of graduates entering the profession. It fails to uphold the responsibility of the educator to ensure graduates meet the required standards for safe and effective nursing practice, potentially violating professional standards and accreditation requirements. Professional reasoning. When faced with challenges related to standardized testing, nurse educators should employ a systematic, data-driven approach. This involves 1. Understanding the purpose and psychometric properties of the chosen standardized test. 2. Analyzing student performance data in conjunction with curriculum content and learning outcomes. 3. Investigating potential discrepancies or trends by examining test blueprints, item analysis if available, and student feedback. 4. Collaborating with colleagues and program leadership to interpret findings and develop evidence-based strategies for improvement, which may include curriculum adjustments, pedagogical enhancements, or targeted student support. This process ensures that decisions are grounded in sound educational principles and ethical considerations, ultimately benefiting both students and the nursing profession. Question 19. Analysis of a recent performance review for a group of critical care nurses reveals a trend of increased documentation errors and delayed medication administration. The nurse educator is considering developing a continuing education module. Which of the following approaches to needs assessment would best align with regulatory requirements and best professional practice for nursing education? Option A. Creating a presentation on advanced pharmacological interventions, as this is a topic frequently requested by nurses in other departments and is considered a high-level skill. Option B. Designing a workshop focused on general nursing ethics and professional conduct, assuming that any perceived performance issues are likely rooted in a lack of foundational understanding. Option C. Developing a module based on the educator's observation that nurses in the unit seem generally overwhelmed and might benefit from stress management techniques, as this is a common issue in critical care. Option D. Conducting a comprehensive needs assessment that includes a review of incident reports, analysis of electronic health record data related to documentation timeliness and accuracy, and interviews with charge nurses and unit managers to identify specific system or process issues contributing to the observed trends. The correct answer is D. Conducting a comprehensive needs assessment that includes a review of incident reports, analysis of electronic health record data related to documentation timeliness and accuracy, and interviews with charge nurses and unit managers to identify specific system or process issues contributing to the observed trends. Explanation. This scenario presents a common challenge in nursing education, identifying and addressing knowledge gaps within a diverse group of practicing nurses. The professional challenge lies in accurately assessing needs without making assumptions, ensuring the educational intervention is relevant and effective, and adhering to professional standards for continuing education. Careful judgment is required to move beyond superficial observations and delve into the underlying reasons for perceived deficits. The correct approach represents best professional practice because it systematically gathers data from multiple sources to understand the actual learning needs of the target audience. This aligns with the principles of adult learning theory, which emphasizes learner-centered approaches and the importance of assessing prior knowledge and experience. Furthermore, regulatory frameworks for continuing nursing education, e.g., state boards of nursing regulations in the U.S., often mandate that educational activities be based on identified needs and evidence of practice gaps. A needs assessment that utilizes objective data, such as performance metrics, patient outcomes, and direct feedback, ensures that the educational program is not only relevant, but also justifiable and accountable to regulatory bodies and the profession. An incorrect approach that relies solely on anecdotal evidence or the instructor's personal perception fails to meet the rigor expected in professional nursing education. Such an approach risks creating an educational program that is misaligned with actual practice needs, leading to wasted resources and potentially failing to improve patient care. Ethically, it is a disservice to the learners and the profession to provide education that is not evidence-based or needs-driven. Regulatory failure occurs when the needs assessment process does not meet the standards set by accrediting bodies or state boards of nursing, which often require a documented and systematic process for identifying learning needs. Another incorrect approach that focuses only on what nurses say they want to learn, without correlating it to actual practice deficits or patient outcomes, can also be problematic. While learner preference is a factor, it must be balanced with the identified needs of the practice environment and patient population. This approach may lead to the development of courses that are popular, but do not address critical areas for professional development or patient safety, thus failing to meet the core purpose of continuing education. The professional decision-making process for similar situations should involve a multifaceted approach to needs assessment. This includes 1. Identifying the target audience and the context of their practice. 2. Reviewing relevant literature, professional standards, and regulatory requirements. 3. Gathering data through a combination of methods, such as surveys, interviews, focus groups, chart audits, performance reviews, and analysis of patient outcome data. 4. Analyzing the collected data to identify specific knowledge, skill, and attitude gaps. 5. Prioritizing identified needs based on impact on patient care, safety, and professional standards. 6. Documenting the entire process to ensure transparency and accountability. Question 20. Benchmark analysis indicates that a significant number of nurse educators struggle with the practical implementation of constructing and refining multiple-choice questions that accurately assess complex clinical reasoning skills while remaining free from bias. A newly developed curriculum has clearly defined learning outcomes for a critical care nursing course. The nurse educator is tasked with creating a comprehensive examination to evaluate student mastery of these outcomes. Which of the following approaches best reflects best professional practice in constructing effective test items for this scenario? Option A. Create a large number of questions covering the broad scope of critical care nursing, prioritizing the use of advanced medical terminology and complex case studies to ensure the examination is sufficiently rigorous. Option B. Rely on the educator's extensive clinical experience to intuitively select questions that are perceived to be challenging and representative of real-world critical care situations. Option C. Develop items that directly map to each learning outcome, using clear and unambiguous language, and pilot test them with a small group of experienced nurses to identify any potential ambiguities or biases before final administration. Option D. Focus on the quantity of questions, ensuring there are enough items to cover all topics, and assume that if the majority of students pass, the items are effective. The correct answer is C. Develop items that directly map to each learning outcome, using clear and unambiguous language, and pilot test them with a small group of experienced nurses to identify any potential ambiguities or biases before final administration. Explanation. Scenario analysis. This scenario presents a common implementation challenge for nurse educators, ensuring that assessment items accurately reflect the intended learning outcomes and are free from bias, while also adhering to established psychometric principles. The challenge lies in balancing the need for rigorous evaluation with the practical constraints of item development and the diverse backgrounds of the student population. A nurse educator must possess a keen understanding of how to construct items that are both valid and reliable, and how to critically evaluate existing items for potential flaws. This requires more than just subject matter expertise. It demands pedagogical skill and an awareness of assessment best practices as outlined by professional nursing education standards. Correct approach analysis. The correct approach involves a systematic review of test items against the stated learning objectives and a critical evaluation for potential bias. This aligns with the core principles of educational assessment, emphasizing content validity. the extent to which the test measures the intended content and fairness. Professional nursing education guidelines, such as those from the Certified Nurse Educator, CNE, credentialing body, stress the importance of developing assessments that are aligned with curriculum and free from irrelevant difficulties or discriminatory language. This approach ensures that the assessment truly measures the knowledge and skills related to the learning outcomes, rather than extraneous factors. Incorrect approach is analysis. One incorrect approach focuses solely on the number of items without considering their quality or alignment with learning objectives. This fails to meet the fundamental requirement of content validity and can lead to an assessment that is not a true measure of student learning. It also disregards the principle of efficient assessment design, which prioritizes quality over quantity. Another incorrect approach prioritizes the use of complex vocabulary or obscure clinical scenarios simply to make the test appear more challenging. This introduces irrelevant difficulty, a known flaw in test item construction. Such an approach can penalize students who have mastered the core concepts, but may struggle with advanced terminology or less common presentations, thereby compromising the assessment's validity and fairness. This is ethically problematic as it does not accurately reflect the student's ability to apply nursing knowledge. A third incorrect approach involves relying on personal intuition or anecdotal evidence about item difficulty without employing systematic evaluation methods. This lacks the rigor required for sound assessment practices and can perpetuate biases or inaccuracies in the test. Professional standards for nurse educators emphasize evidence-based approaches to assessment, which includes objective item analysis and review. Professional reasoning. Nurse educators should employ a structured approach to test item construction and review. This involves 1. Clearly defining learning outcomes. 2. Developing items that directly assess these outcomes. 3. Reviewing items for clarity, accuracy, and absence of bias. 4. Piloting items where feasible. And 5. Conducting item analysis post-administration to identify problematic items. When faced with an existing assessment, a critical review process that compares items against learning objectives and screens for irrelevant difficulty and bias is paramount. This systematic process ensures that assessments are valid, reliable, fair, and ethically sound, upholding the professional standards of nursing education.